Imagine waking up one morning feeling just a little more tired than usual. Maybe your joints ache. Maybe you notice a strange bruise on your arm, or you find yourself short of breath after walking up the stairs, something that never used to bother you before. You chalk it up to getting older, a rough night's sleep, or maybe you just brushed up against something without noticing. But what if these seemingly ordinary signs are actually early warnings? Not of aging, but of something much more serious? Something that could change your life and the lives of those you love forever? Blood cancer. Just the words are enough to send a chill down your spine. It's the silent intruder, the hidden threat that too often goes unnoticed until it's too late. Every year, thousands of Americans, good, hard-working people, are blindsided by a diagnosis they never saw coming. Why? Because blood cancer doesn't always begin with dramatic, unmistakable symptoms. No, its earliest warning signs are subtle, easy to ignore, and all too often mistaken for the normal aches and pains of everyday life, especially as we age. But what if I told you that simply knowing what to look for could make all the difference? That by recognizing these early signals, you could give yourself, or someone you care about, a fighting chance? Today, we're going to talk about the early signs of blood cancer that most people miss. We're going to break through the confusion, the myths, and the fear, and arm you with the knowledge you need to protect yourself and your loved ones. Because when it comes to blood cancer, early detection is everything, and your life is too precious to leave to chance. Let's get started! First, let's take a moment to understand what blood cancer actually is. Blood cancer isn't just one disease. It's a group of cancers that affect the blood, bone marrow, and lymphatic system. The three main types you'll hear about are leukemia, lymphoma, and multiple myeloma. Each one has its own unique characteristics, but all of them disrupt your body's ability to produce healthy blood cells. That's why the signs can be so varied and so easy to overlook. Now, I want you to think about your own life, or the life of someone you love. Have you noticed changes in your energy levels? Have you brushed off little things thinking, it's nothing, just part of getting older? You're not alone. I've been there too. I remember when my old friend Tom started getting winded just walking to his mailbox. He thought it was his age catching up with him. None of us ever imagined it could be blood cancer. So, what are these early signs that slip through the cracks? Let's walk through them together, one by one. Fatigue. Not just the kind of tiredness you feel after a long day or a restless night, but a deep, bone-weary exhaustion that doesn't go away, no matter how much you rest. It's the kind of fatigue that makes everyday tasks feel insurmountable. This is one of the most common symptoms of blood cancer, but it's also the easiest to dismiss. After all, who doesn't get tired now and then? But if you find yourself struggling to get out of bed or you just can't muster the energy to do the things you once enjoyed, don't ignore it. Unexplained bruising and bleeding. Have you ever noticed a bruise on your arm or leg and couldn't remember how it got there? Or maybe you found that you bleed more easily than you used to. Maybe your gums bleed when you brush your teeth, or you get frequent nosebleeds. These can all be signs that your blood isn't clotting the way it should. In blood cancers like leukemia, your body's ability to produce healthy platelets is compromised, making you more susceptible to bruising and bleeding. Frequent infections. We all catch a cold now and then, but if you find yourself getting sick more often than usual, or if minor infections seem to linger and worsen, it's time to pay attention. Blood cancer can weaken your immune system, leaving you vulnerable to infections that just won't quit. Maybe it's a sinus infection that drags on for weeks, or a cough that refuses to go away. Don't just tough it out. Your body is trying to tell you something. Swollen lymph nodes. You might notice lumps or swellings in your neck, armpits, or groin. These are your lymph nodes, and when they swell up, it's usually because they're fighting off an infection. But in the case of lymphoma or leukemia, swollen nodes can be one of the earliest signs of trouble. They're usually painless, which makes them easy to ignore. But if you notice persistent swelling, especially if it doesn't go away after a couple of weeks, get it checked out. Night sweats. We're not talking about the occasional hot flash or the odd warm night. These are drenching sweats that leave you and your sheets soaked, night after night, even in a cool room. Night sweats can be a sign that your body is fighting something serious. Unexplained weight loss. Losing weight without trying might sound like a blessing, but if the pounds are slipping off and you can't figure out why, it's a red flag. Cancer cells can hijack your body's energy, causing you to lose weight even if you haven't changed your diet or exercise routine. Bone pain or joint pain. This isn't just the stiffness you get from a long walk or a day in the garden. Blood cancers, especially multiple myeloma, can cause deep, persistent pain in your bones or joints. If the pain is new, severe, or won't go away, it's worth asking your doctor about it. Shortness of breath. Maybe you notice it climbing stairs, maybe it's just walking across the room. Blood cancers can lower your red blood cell count, making it harder for your body to carry oxygen. You might feel winded more easily than before, or notice a racing heart. Sometimes, folks mistake this for heart or lung problems, but it can also be a sign of something happening in your blood. Paleness or jaundice. If your skin or the whites of your eyes start to look unusually pale or yellow, this can indicate anemia or liver involvement, both of which are possible in blood cancer. Friends and family might notice this before you do. Don't brush it off as just looking tired. Persistent fevers or chills. If you're spiking fevers for no apparent reason, or you can't shake a low-grade fever for days or weeks, your immune system may be under attack. Chills that come and go or that make you shiver uncontrollably can also be a red flag. Tiny red spots on your skin called petechiae. These little dots often appear on the legs, arms, or inside your mouth. They're caused by bleeding under the skin due to low platelet counts. They're easy to overlook or mistake for a rash, but if you see them, don't ignore them. You might be thinking, but these symptoms sound like a dozen other things. Isn't this just part of getting older? That's the dangerous part. Blood cancer is a master of disguise. It mimics normal aging, stress, minor infections, and more. But if you experience several of these symptoms at once, or if they're getting worse instead of better, you owe it to yourself to talk to your doctor. Now, I want to slow down for a moment, because I know how easy it is to brush these things off. I've done it myself. We don't want to be a bother. We don't want to seem like hypochondriacs. Maybe we're afraid of what we might find out. But let me tell you something. From one old-timer to another, courage isn't the absence of fear. It's doing what needs to be done, even when you're scared. When my neighbor Linda started losing weight and feeling run down, she thought it was just the stress of caring for her grandkids. It wasn't until her daughter insisted she see a doctor that they discovered she had early-stage lymphoma. Because they caught it early, Linda got the treatment she needed, and today she's back to her old self, baking cookies, spoiling her grandkids, and living life to the fullest. That's the power of paying attention. I know how overwhelming all this can sound, but there's hope. Blood cancer isn't the death sentence it used to be. Thanks to advances in medicine, treatments are more effective and less harsh than ever before. Survival rates have improved dramatically, especially when the disease is caught early. That's why awareness is so important. That's why I'm sitting here, sharing this with you. Now let's talk about what to do if you notice these warning signs. First and foremost, don't panic. Most of the time, these symptoms are caused by something much less serious. But don't ignore them either. Make an appointment with your doctor and be honest about what you're experiencing. Write down your symptoms, when they started, how often they happen, and whether they're getting worse. The more information you can give your doctor, the better. Don't be afraid to ask for blood tests. A simple blood test can reveal a lot about your health, including your red and white blood cell counts, your platelets, and signs of infection or inflammation. If your doctor brushes off your concerns, don't be afraid to ask for a second opinion. You know your body better than anyone. Trust your instincts. If you're diagnosed with blood cancer, remember, you're not alone. There are incredible support groups, both in person and online, filled with folks who've been where you are. Lean on your friends and family. Let them help you. And most importantly, never lose hope. It's also important to remember that there are risk factors for blood cancer. Some we can control and some we can't. Age is a big one. Most blood cancers are more common in people over 60. A family history of blood cancer can increase your risk, as can exposure to certain chemicals like benzene or radiation. Smoking, obesity, and certain infections can also play a role. While you can't change your age or your family history, you can make choices that support your overall health, like quitting smoking, maintaining a healthy weight, and getting regular checkups. And if you're caring for someone else, an aging parent, a spouse, a friend, don't be afraid to speak up if you notice changes in their health. Sometimes, we need someone else to notice what we're too close to see. Before we wrap up, I want to leave you with this. Your life matters. The lives of your loved ones matter. Don't let fear or denial rob you of the chance to catch blood cancer early. Listen to your body. Speak up if something doesn't feel right. And above all, remember that you have the strength to face whatever comes your way. If this video helped you, don't keep it to yourself. Subscribe now, leave a comment about your experience, and share this with a friend who might need it. You never know whose life you might save by spreading the word. Let's look out for each other. Let's stay informed, stay connected, and stay strong. Thank you for watching, and take care of yourself and each other.